Hi, everybody. Welcome. If you are seeing this for the first time, if you are coming back, welcome, welcome, welcome. I'm Dr. Megan. This place is a place for medically based answers for your weight questions. If you are confused about weight medications, you have a lot of confusion or overwhelmed, or you just don't know what you should listen to, what you don't, what is not important, you are in the right place. So welcome. I'm Dr. Megan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And today I'm going to be answering all your questions about weight and weight medication. And you guys had some great questions. So if I didn't get your question today, I will definitely add it on for future videos. So thank you for sending these in. All right. First question. These were, let's see, follow up to the other weight, ask me anything videos. As a side note, if you want to work with me directly, you can. I will leave all that information down below. Okay. Question number one, what would be deemed as quick weight loss? I would say generally quick weight loss is more than 2 pounds per week, or more than 1 kilogram, which is 2.2 pounds per week, is thought of as, faster weight loss. And so yeah, for some people on these medications, you can't really control the rate of it. So some people lose weight pretty quickly. Some people lose weight very slowly. But that's a good ballpark to think about. Okay, next question. And as a side note, I'm not going to answer personal medical questions because this is really for educational purposes. So if your question is a little bit more medically, personally related, I'm going to change a little bit so it is a broader educational context. Okay, so if someone's doing 30-minute runs every day with medication like Wegovy or Ozempic, will this enhance the loss? I think it's always excellent if people are doing regular cardiovascular exercise. Daily is awesome. I don't think I think that, if that's what you like to do, if that's what your preference is, great, go for it. What we tend to see in studies is that exercise doesn't cause, and this is caveat, everybody's different, but exercise doesn't typically bring about a lot of significant weight loss on its own, but it definitely helps augment existing changes, and it certainly helps with weight maintenance. So I think if they're running pretty regularly and they're on something like Wegovy, it's definitely going to help. Also, you're going to feel better, right? You're going to feel, if you're running, pretty consistently, you're going to feel better. You're going to be like your body's going to be easier to move. So there's just a lot of benefits that come with regular exercise. I will say, if you are on a medication like Wegovy, Ozempic, Zepbound, it's also very important to do strength training, because as you're losing weight, you want to preserve your muscle mass. And anytime you lose weight through medication, through surgery, you will have some muscle loss with the fat loss. And so you just want to make sure that you're offsetting that as much as possible by making sure you're getting adequate protein and getting strength training in. So about 2 sessions a week of 30 minutes is a good ballpark place to think about. So if you're running, excellent, definitely will help with weight maintenance and usually weight loss. And just make sure you're getting some strength training in too. Okay. My body type. Okay, let me just make this a little more. Okay. So if someone has a more muscular body type and they have, they're overweight or they have obesity, what is the right weight to get to? That is a great question because it gets to the heart of this issue of, BMI and just what the goals are. And if people have a lot of muscle, then doesn't really give you the full picture. The scale doesn't really give you the full picture of their health. Well, it never gives you the full picture of their health, but it's a little less reliable, especially for people who have muscle. So for those people, I would, the body scan or the DEXA is really going to be much more helpful for you in terms of weight goals. I would really focus more on your body fat percentage and what you want that to be, your percent lean muscle mass and what you want that to be. That's going to be a lot more helpful in terms of just what this number is on the scale. And I have a whole video about, this is better than your scale, so I'll link that down below. But that's going to be a lot more helpful in terms of your goals. And then, do supplements have any benefit during weight loss? I think, supplements are always so appealing because they're easy to add in. And I definitely recommend people take a multivitamin, calcium and vitamin D. Those are broadly what I recommend for people, especially women, perimenopausal, postmenopausal. Calcium and vitamin D are very important. But, definitely talk to your physician about what supplements are right for you. But I will say I don't really feel, other than like a regular multivitamin and the calcium and vitamin D, I really don't see a role for anything else, because what you really want to be doing is focusing on getting optimizing your diet, which should have a lot of fiber, should have a lot of vitamins, should have a lot of whole foods in it. That's harder to do than taking a supplement. I think a multivitamin is great because, especially in the beginning, some people, they just don't have much of an appetite. They're not eating a lot. The last thing any physician wants is for someone to get malnourished while they are, trying to get healthy. So I think a multivitamin is a great thing to add. So yes, could definitely do that. But otherwise, get your fiber through dietary sources. That I would definitely do instead. All right. Oh, also, I wanted to just touch on there was news today about you guys probably heard of this company, Hims, which is kind of like an online direct pharmacy telehealth. And they do a lot of hair care, dermatology, what have you. But I think they just announced today that they are going to be doing GLP-1 injections, like compounded semaglutide. And I have a whole video on, kind of off-label weight medications. I want people to have as much access to these as possible, of course. But these are like medications. These are not just, grocery ingredients that you can buy. So you have to be really careful, and the FDA does not regulate these the same way. And there's been plenty of warnings about using compounded products. And there's certainly a time and a place for compounded medications. But so I won't go into all that now. It's all in the video if you want to watch it, and I'll link it. But buyer beware. It's definitely not something I will be sending my patients to get if they cannot find Wegovy or Zepbound. I am not, hooking them up with a compounding pharmacy to get their medications. We are finding other safe ways that are workarounds, and this is just the landscape of the time that we're in. there's going to be something else that comes out that's going to be amazing, better than Zepbound, and everybody's not going to want that anymore. There's going to be a lot of fluctuations. And so anybody who's starting a medication, just be aware that it's not like getting a statin or a blood pressure medication where the supply is very, there's lots of generics, the supply is steady, you can just go to the pharmacy and pick it up as soon as your doctor prescribes it to you. It's just not like that. So how can you take a medication and be safe? That is a great question to have with your prescribing physician. Okay, next question. Okay, this was about Mounjaro side effects. Mild side effects, what's your definition of mild? You're pushing a drug without giving true facts. I disagree. I think I'm all about the true facts. I'm definitely not pushing drugs. But yeah, I would say mild means annoying but manageable. I definitely know that some people on Mounjaro, Zepbound, any of these medications, their symptoms are not mild. They can have very severe symptoms. People can have, feel like they've got food poisoning for days. Like for some people, it's not a great fit for. I definitely get that. But yeah, I would say most people, again, I prescribe these all the time. I'm talking to patients about these all the time. Usually what happens is they're like, yeah, some diarrhea, some constipation. Sometimes it goes away, sometimes it doesn't, but it's not, severe, people, interfering with people's days, things like that. But every once in a while, people have side effects that are not mild. So that's my definition. This question is about skipping doses. Okay. If someone's appetite is suppressed, okay, and this is about, I think this is about someone who is thinking about Zepbound. Okay. If someone's appetite is suppressed at 5 units, like 5 milligrams, does this person have to increase to 10? And the answer is absolutely not. If someone is getting a very strong appetite suppressant effect at 5 milligrams, again, no doctor wants you to become malnourished on these medications, right? So if I have a patient and they're like, yeah, I am not having a lot to eat on this medication, I will either keep them there for longer and see if that goes away and keep a close eye on their, daily intake, or I'll bump them down a little bit. And some people just need a longer time on a dose before you escalate them. So it doesn't mean if somebody's on Zepbound 5 milligrams that they won't ever get to 10 milligrams. They might not ever need it. Some people get the result that they are looking for at a lower dose. Definitely happens. Or their body's just, really, really feeling the response to the medication, and you don't want to push it up too quickly because, the side effects of a severe appetite suppression is something you want to watch before you escalate it all. So I would either bump that person down to the 2.5 milligrams, or I would watch them at the 5. It really depends on what their dietary intake is like. If somebody's like, I'm having 3 bites of food per day, yeah, that's somebody I might, probably bump them down, maybe take them off for a little bit. It really depends on the person, but you have to watch it carefully. Definitely not somebody I would feel like I wanted to bump them up, but sometimes, your body gets used to these medications, and then, 3 months from now, they might be ready to go up to the 10 milligrams if they are still not quite at the BMI where they and their physician feels like it's safe for them. So, okay, that's going to do it for today. These are awesome questions. Again, if I didn't get your question today, I'm going to add it on to a future episode. And if you have questions after watching this, please feel free to leave it down below. and I'll answer in the future. And thank you so much. Please be well. Bye.